Good afternoon, colleagues, and thank you for taking the time to join us for this webinar this afternoon. Let me welcome you on behalf of our director, Mr. Derek Springer. This afternoon, we have Lisa Tarantino and Sarah Insamali, who will be co-presenting on strengthening the sustainability of HIV response in the Caribbean. Just a few housekeeping pointers before we proceed. Firstly, your mics are muted. If there are any questions, please write them down in the chat bar. We will address them during the question and answer segment after the presentation. Like I said, this afternoon we have two presenters. We'll take both presenters, followed by the question and answer segment. And finally, this webinar is being recorded and will be shared on PANCAP's website for the wider partnership. With that, I'm pleased to introduce our speakers this afternoon. Our first presenter is Lisa Tarantino. She is the Eastern and Southern Caribbean Regional Program Manager for the USAID-Funded Health Finance and Governance Project and is a Principal Associate with ACT Associates Incorporated. She has spent 20 years career implementing and managing global health and enterprise development programs in over 20 countries, including 10 Caribbean nations. Ms. Tarantino has worked in the Caribbean region since 2010, implementing health financing and governance activities designed to strengthen the sustainability of the HIV response. Previously, she worked for the European Bank for Reconstruction and Development, designing countries' small and medium enterprises development strategies at the Development Alternative International, providing training and consulting to banks and small and medium enterprises, and as a small business loan program manager at the Investment Fund. Ms. Tarantino has a master's degree in international affairs from Columbia University School of International and Public Affairs, speaks Russian, and is an adjunct professor at Columbia University. Our second presenter is Sarah Insamali. She is the country manager for Guyana and Suriname for the USAID-Funded Health Finance and Governance Project, and is a senior associate with ACT Associates Incorporated. Sarah has more than 16 years of Caribbean-based experience working in public health and development at both the national and regional levels. She is a former head of planning at the Guyana Ministry of Health and has worked in multiple capacities at PANCAP, where she has played a leading role in the development of the Caribbean Regional Strategic Framework 2014 to 2018 and PANCAP Global Fund proposals. As a consultant, Sarah has supported the work of regional agencies such as CARFA, CAHO, the CARICOM Secretariat, the Caribbean MedLab Foundation, and CARIFLABS. She has a Bachelor of Arts degree in History and Science from Harvard University, a Master's in International Affairs from Columbia University School of International and Public Affairs, and a DRPH from the University of the West Indies in 2017. I now hand you over to Lisa and Sarah.
Thank you very much, Shanti. Good afternoon, and thank you to PANCAP for giving us this opportunity to speak today. So today, Sarah and I are going to be talking about sustaining the HIV response in the Caribbean. There will be three parts to the presentation. One, we're going to talk about the big picture. Why is sustainability an issue right now? Why is it urgent? Why is now the time for countries and civil society organizations and other stakeholders to be focused on the sustainability of the response? What are some strategies for sustainable financing and strategies for more sustainable programming even in the region and also outside of the region? And what are some experiences and lessons that can be taken from within the region? And what are countries doing now that we could learn from? So what do we mean by a sustainable HIV response? USAID And PEPFAR defines a sustainable response as one where a country has the enabling environment, services, systems, and resources required to effectively and efficiently control the HIV and AIDS epidemic. According to the Global Fund, sustainability is maintaining service coverage at a level that will provide continuing control of a health problem even after the removal of external funding. These are two definitions that are widely used at the country level. Countries, program managers may adapt these definitions and develop their own understanding of what they mean by an HIV response. So in the Caribbean and in many parts of the world, countries where HIV is a significant issue are growing. Their economies are growing, their incomes are growing, and their capability of addressing the HIV epidemic has increased. So why is this a concern now? This is a quote from a webinar that I listened to just a few months ago by Dr. Mark Dybel. And as the former head of PEPFAR and a former head of the Global Fund, I thought his statement was quite striking, that we are in the greatest danger ever of losing control of the epidemic. I think his point is, and I would agree, that as development partners begin to reduce their support for the HIV response, it's a bit of a passing of a baton from one to another as they give more of the management control. They pull away from their close involvement in the HIV response, as well as removing financing. And that is a precarious moment. Also, the disease has changed and the response to the disease needs to adapt. As countries look to adopt the treat all recommendations of WHO, that puts increasing strain on their finances and their capacities right at a moment when development partners are reducing funding. The reality also is that it is increasingly difficult, or it will be difficult going forward, for that level of funding to ever come back. That there are a lot of competing needs for financing. There are changing demands on the attention of development partners, and so the reality is that this funding is being taken away, and there needs to either be a replacement or a way of managing the response in a more cost-effective manner. So what are we talking about when we're looking at funding for HIV in the Caribbean? So this data is from the Global AIDS Monitoring Tool, and it's in US millions of dollars. And it looks historically on what had been spent and where we are about now. And you can see where some other international partners have reduced their funding in recent years. The US government is still a very large funder of the HIV response in the Caribbean, but that is projected to change. And while the US is still supporting sustainable response in the region, in the coming 2 to 5 years, the level of support is projected to decline, and that's been communicated by PEPFAR. Global Fund as well. They're shifting the focus of their funding, and in some countries they're pulling out. And yet the needs for financing have increased, especially for countries that are looking for treat all. So the response is underfunded, and more of the burden for funding the response is going to be on countries and the region. Where's the funding needed? Scaling up, as I mentioned, moving to treat all, scaling up, sustaining ART. It means that labs, there needs to be laboratory capacity and other services. It puts a burden on the health system. And also prevention is a priority in the region, where the rate of new infections are not declining and new approaches are needed to tackle the issue of prevention more effectively. Development partners, as I said, while some development partner funding is reducing, there's also a bit of a shifting in the emphasis of where the funding is going, whereas in the past, in the early days of the response, much of it went into training and the purchase of ARVs and direct supplies. Now it's starting to pull away as countries are taking on more ownership, and development partners are their last pieces of support are going towards protecting human rights and access to HIV services for key populations, and continuing to engage and maintain the capacity and help build the capacities of the civil society organizations that are so essential to serving those key populations. So what are some strategies? How can the countries in the region approach this issue? It's resource mobilization, and that's a big theme of the work that the HFG project does, the Health Finance and Governance Project in the region. And resources can come from government funding, but also from the private sector, although to be realistic, while leveraging the private sector is important, and I think there's a lot of potential there, in terms of direct funding, the private sector is not going to directly replace everything that the development partners provide now. So there needs to be a realistic expectation of private sector engagement. Philanthropic organizations, and also out-of-pocket payments and private insurance mechanisms can have a role. So making the case, and this is where we're talking about government budgets and funding for health and other social services. How can stakeholders and ministries of health make a case for a bigger slice of the pie, a bigger piece of the budget for HIV, to replace development partner funding in some cases, and also to support scale up? It needs political will, and this is a good time because there is political will and attention being placed to the transition from development partner funding. Improving public financial management, that's what PFM stands for, and that is improving the dialogue between the ministries of health and ministries of finance, where they often speak a different language, really, when thinking about budgeting and expenditures and returns on investment. Key performance indicators can help, where the ministries of health and AIDS programs can communicate clearly how the funding that the Ministry of Finance allocates is being spent, and that they're performing against indicators that are reasonable. And lastly, data. It really does, it helps to be able to show what are the needs of the response and where's the money going, and to be able to report against it. So some ways, some strategies can be including HIV into national health insurance schemes, earmarking taxes for HIV and or health within, and having HIV as part of that, social contracting and grants, which are two mechanisms that many countries, actually several countries in the region, use now to fund non-government entities to provide social services, and that can be expanded for HIV. Trust funds, which can be, and private sector funds, and in some countries have, for instance, Tanzania developed a government trust fund. There are private sector funds that could be explored for HIV, and other public-private partnerships to further leverage the private sector. The other side of resource mobilization, domestic resource mobilization, is seeking efficiency gains. And when I say, just to pause for a second, when I say domestic resource mobilization, I think in the Caribbean, regional public goods are also a real important factor, and especially thinking about things like the lab systems and other regional goods. So domestic resource mobilization in the case of the Caribbean can also include regional resource mobilization. So there's increasing funding, but then the other piece is seeking efficiency gains and getting more more results for the same amount of funding, and also trying to free some savings from potentially inefficient service delivery or procurement that you can use for other parts of the HIV response. And here, USAID's Health Finance and Governance Project and the Global Health Supply Chain Management Projects have been working to help governments to get good information about how they may be able to realize savings through procurement and supply chain management. And there's also service delivery models, particularly integration into the primary healthcare system, that can achieve efficiencies. So what specifically have countries in the region been doing? And I do hope that there are some representatives of these countries participating, and we would love to hear from you, and also to at the end of our presentation, if you have any comments or questions, we're very welcome. So the Organization of Eastern Caribbean States, they were given clear indication that PEPFAR funding would be basically being ceased, that PEPFAR support was being withdrawn, and that global fund funding would be decreasing. And so in 2013, 2014, they engaged with a series of investment cases, which are mapping the resource needs and the resource availabilities against where those resources will have an impact on new HIV, on the rate of new infections and the rate of death attributable to HIV. So here you have an example, one of the figures from 6 countries combined investment cases, where it shows how much resources are available and what are the projected costs needed to achieve the goal of 90-90-90. And they use these investment cases for advocacy with their own governments to increase government support for the response, as well as for a multi-country concept note for global fund support, which was successful. Barbados is a very interesting example, in my opinion, where they have successfully used a number of economic studies for advocacy and policy, starting with the health accounts estimation of, I think it was 2013, where they looked and they could really see from the results of this study where their funding was going, is how much was being spent on different diseases, and mapping that against where they felt the greatest burden was and what the funding needs would be. They did a supply chain efficiency costing, where they found that they could save as much as $1 million with changing their procurement and supply chain management system. Sustainability index dashboard, and this is a PEPFAR tool which works, which is I think it's a really good tool where resources can be pulled together and stakeholders to engage to identify a baseline or of where the country is in terms of sustainability, and to help see clearly what and define what the priorities can be for investments going forward to improve sustainability. And lastly, in the midst of this, right now in the midst of costing community-based services that are being offered by CSOs that are currently funded by USAID or having support from USAID, so that they can help to understand, for the government to understand, what are the costs of these services, and if they wanted to budget to take up financing the services, what would that cost? So this is an excerpt from their health accounts estimation report, also known as NHA, where they could see, okay, and now we know and we can measure that the household spending is about 39% of overall health spending. This was not, a good news for Barbados, as they want to achieve universal health coverage, because that is a measure of risk really on individuals and the families that have to pay out of pocket for health care. And then you can see the level of donor support and government. And while the donor support is quite small, it can be disproportionately large percentage of certain health response certain health areas, such as HIV. And here, the health accounts estimation broke down in the cases where the spending could be linked to a specific disease. And for those of you that work with budgeting and in ministries of health, you know that not all of every dollar, every is mapped directly to a specific program, but where it was identifiable, this is the breakdown, and they could see where exactly their funding was going. And what were the policy implications? So I know that there was, and also there was a CDC study that costed out Treat All. So that particular CDC study was used to help advocate for increased funding for Treat All for the roadmap to end HIV in Barbados. Also, the Health Planning Office used the results of the health accounts estimation to advocate with the Ministry of Finance for increased spending for NCDs, non-communicable diseases, and that resulted in a tax on sweetened beverages, which has been a revenue generator for the government. And they're looking to realize some savings. Hopefully those savings will be funneled right back into the response. And all of this work is going to be fed into a sustainability planning process where Barbados has a really good sense of what their resources are, what their resource needs are going to be, and can begin to make a good, reasonable plan for moving forward and strengthening sustainability. I'm going to hand it over to my colleague, Sarah and Sonali, to talk about some more experiences from the region. Sarah?
Hi, good afternoon, everybody. So I'm going to pick up from where Lisa left off and talk about some other experiences from the region that HFG has been supporting, and including working with the governments of 5 countries, the Dominican Republic, Barbados, Guyana, Suriname, Trinidad and Tobago, to develop sustainability plans for their HIV responses. And here we're highlighting the Guyana process, which really has been a careful and deliberate approach with coordinated support from international partners and broad inclusion of stakeholders. And we're condensing this very careful process into these 5 steps. So Guyana started by making sure that it had a mechanism in place to ensure multi-sectoral national ownership of the sustainability planning process. And what they did was establish a high-level sustainability task force that included a range of key stakeholders across sectors. And the task force has been charged with overseeing both the development of the sustainability plan and is also going to be responsible for monitoring and overseeing its implementation. A second critical step was defining what sustainability really meant for the country and for that particular national context. Lisa earlier talked about, provided some definitions of sustainability that can provide a good jumping off point for countries. But at the national level, it really requires a full range of country stakeholders coming together to discuss and come to some kind of consensus on the country's policy direction, what the priorities are, and what the challenges are for sustainability. The third step, assessing the response and agreeing on priorities, and 4, identifying major strategies for sustainability. I'm going to talk about those in a little bit more detail. And then finally, making sure that your sustainability plan has an implementation and monitoring plan. And in the case of Guyana, what they have chosen to do is develop both a broad overarching 5-year roadmap that has quite high-level milestones attached to it, as well as a detailed costed 1-year implementation plan that really gets into kind of the nitty-gritty of how this plan is to be implemented and what are the resource needs and what are the responsibilities of various stakeholders. So back to that step 3, assessing the response. So in the case of Guyana, again, the approach really was to make sure that there was an inclusionary and participatory process to assessing the response and building the evidence base for the sustainability plan so that a range of perspectives could be captured on the full scope of the HIV response. The studies available in Guyana and the ones listed on this slide are really just a small subset, but they illustrate the scope of the possible studies that have engaged a wide range of stakeholders. And I think how the assessment is approached in other countries, of course, depends on the particular country context. But just to say, it doesn't always require additional work. And in the case of Guyana, again, a lot of these studies were already available and could be used for sustainability planning. Or, you know, it may require just focused attention to particular information gaps. And then just quickly on the right of the slide, just to show the outcome of a sustainability index dashboard process. And this is a tool that HFG has helped to implement in Barbados, in Trinidad and Tobago, and in Guyana. And what the tool does is allow stakeholders to come together to discuss and examine the status of the national response in 4 areas. And the 4 areas are governance, leadership, and accountability, national health system and service delivery, strategic investments, efficiency, and sustainable financing, and strategic information. And stakeholders sit down and discuss and kind of come to a consensus on answers to particular elements of the national response. And what the CID does is collate those and score them and then summarize them in this great visual tool that makes it very easy to see where attention is needed. So what can we learn from Guyana's experience that might be useful for a country considering whether or not to invest in developing a sustainability plan? Certainly it doesn't have to be a lengthy document that, you know, will sit on a shelf, but it really should be a practical and usable tool that does the following. It should outline policy priorities and national coverage targets. It should define the essential program components that either need to be continued, scaled up, maybe discontinued even, or introduced in order to achieve those national priorities and targets. It needs to describe the services that have to be financed and service delivery approaches that really can minimize costs, create efficiencies, while maintaining the quality of care and increasing coverage. The plan should also help to estimate the financing needed to implement key program components and should also consider where these funds will come from. It should provide a high-level plan outlining the phased scale-up of government contribution towards full transition from donors, where that is happening, and the responsibilities of each key stakeholder. It's also important to make sure that the plan is defining a realistic schedule for implementation. And what we've found is that a phased approach is useful because in a lot of cases, you know, there are still capacity development needs, and these need to be addressed early on in the process so that other activities can be implemented down the road. The plan should enable monitoring, and so it should have clear benchmarks and indicators to assess effectiveness and to flag risks and bottlenecks. And because it's meant, you know, to be overseen by the Sustainability Task Force, it should allow for updating based on new data and contextual changes. And that's where those costed one-year work plans really help. And then just briefly to highlight some of the strategies that you know, are included in the Guyana Sustainability Plan that might be relevant for other countries in the region to consider. the need to make sure that you have an independent national multi-sectoral oversight mechanism, and of course the majority, if not all of the countries have something already in place, whether it's a CCM or a national AIDS coordinating committee. But looking at what the effect of transition from donor funding might be on that mechanism, how can you institutionalize and strengthen that mechanism to coordinate the multi-sectoral response, and also looking at specifically at that coordination function. Is the NAC, is the CCM focus on implementation, and how can we strengthen the coordination capacity so that we really can make sure that all of the stakeholders are engaged. The need to generate better financial and epidemiological projections, again, to continue to inform programming and the various iterations of the strategy. The need to strengthen a national approach to integration of HIV services. And again, in many cases, this is already happening, but where it is happening on an ad hoc basis, to consider how you can put in place structures, guidelines, to make sure that there is a more coherent national approach to this process. And then the direct contracting of civil society organizations, or social contracting. This is a strategy that many countries, in addition to Guyana, are interested in, and I'm going to talk a bit more about that on the next slide. And Lisa has talked quite a bit already about domestic resource mobilization, about the need for both increasing that and making sure that it is allocated efficiently for capacity building with the Ministry of Finance and the Ministry of Health, for them to be able to work collaboratively. And then also the need to mobilize new sources of domestic funding. So social contracting of CSOs, what does it mean? It really, very simply, just using government resources to fund CSOs to provide services or to achieve certain health outcomes through a legally binding agreement. And again, there are countries that are already implementing this approach. But given that they're facing donor transitions from donor funding, there may be need to strengthen the approaches to working with CSOs as a major strategy for sustainability. CSOs play a critical role in the HIV response in most countries, and they add value with strategies that are based on deep understanding of key populations and of the barriers that these groups face in accessing health services. In a lot of countries, including Guyana, the majority of prevention services targeting key populations are provided by CSOs, as well as some care and support services. But this work has largely been supported by international donors, and in particular, the US government and the Global Fund. So what this strategy is trying to do is to look at the national context and make sure that the elements are in place to establish a mechanism that will allow the government to directly fund the work of CSOs. And the essential elements that need to be in place are a legal framework that facilitates CSOs' work, a clearly defined role for CSOs in the national response. And again, this is, many countries have this already written into national strategies. And the third and big piece are a financing and contracting mechanism or system that provides governments and CSOs with tools to work effectively and to be held accountable to all parties' satisfaction. And again, sometimes this just requires not establishing something new, but working with systems that may already be in place, where CSOs, are subrecipients of a Global Fund grant, or where CSOs receive subventions directly from government agencies. So shifting gears a little bit from talking about national approaches to looking at more regional strategies, USAID has recently supported 3 important events or processes in the region. The first is the LAC3 meeting that was held in Haiti in November 2017, and that provided an opportunity for stakeholders to come together to discuss strategies for transition. The second in March of this year was Ministry of Health and Ministry of Finance workshop that HFG hosted in Barbados, and the intention was to bring together these stakeholders from these ministries to prepare concrete strategies for mobilizing domestic resources for health, and with a specific focus on HIV. And just to highlight a couple of issues that came out of this conversation, the need to really prioritize and allow time for quality communication. Lisa talked about, the different languages that these institutions might speak. I think we will, all of the people who attended this workshop will remember a Ministry of Finance person saying, you're talking about 9 to 9 to 9 to all the time. What is that? We get into our health and our HIV jargon, and forgetting that other agencies have no idea what we're talking about. So the need to establish that communication, and to also have joint strategies to improve shared understanding. So talking about, maybe even having personnel exchanges, or making sure that you're looking for to hire people with backgrounds in cross-disciplinary learning, so that you have some kind of common foundation of understanding. And then the countries that participated in that meeting were Barbados, Guyana, Suriname, and Trinidad and Tobago. And then finally, this has not yet happened, but PANCAP has managed to get the issue of financing for HIV on the agenda of the meeting of ministers of finance that will be held tomorrow in Jamaica. So congratulations to PANCAP for managing that. This, as we all know, is quite significant, because this level of political attention can really help to garner the support that's necessary for country-level initiatives. And then finally, HFG also had the opportunity to work with PANCAP, the PCU, and the PANCAP leadership to help to develop a resource mobilization strategy for PANCAP. As you all well know, PANCAP plays an important role in achieving gains in the HIV response in the Caribbean. And again, much of this work has been supported by development partner funding. And that funding is declining at the regional level as well as the national level. And so the resource mobilization strategy looks to position the partnership for sustainability, and is comprised of 6 components, looking at capacity building needs for resource mobilization, both at the regional level within PANCAP, and then also how PANCAP can support capacity building at the national level. It's looking at support for country efforts to increase DRM from both the government and private sector, how PANCAP and PANCAP members can engage less traditional funders. And this, we're also talking about looking at the intersectional issues. So maybe looking at funders who might be interested in supporting some of the drivers of what we know are the drivers of the epidemic in the Caribbean region, whether that's LGBT issues or domestic violence. So looking to engage those less traditional funders in less traditional funding areas. Engaging the private for-profit sector for corporate citizenship and responsible business practices, and recognizing that in all of the countries, the private sector really is an untapped resource, and we need to do better with leveraging their role, not just in financing, but in resourcing in other ways, the national responses. Number 5 says partnerships to support CSO resource mobilization efforts and resource sharing. So recognizing also that the CSOs at the national level and the resource level sometimes bring relationships with funders and bring resources that can be leveraged, by the national response. So to look to strengthen those partnerships. And then finally, resourcing through in-kind support and non-financial contributions. And this, I think, has been an increasing area of focus for PANCAP from the CARICOM Secretariat in particular. Okay, so just to kind of sum up some important takeaways from the range of experiences that we highlighted, and there are many others that haven't made it into the presentation. But in generally, the countries that HFG has supported and PANCAP at the regional level have taken quite a broad approach to sustainability planning. And I think that they really have recognized that this is an opportunity and to take a hard look at national programs and really consider what national priorities are, what the country wants, and what might be implementable actions to strengthen national ownership, to consolidate the multi-sectoral approach, to really identify effective and feasible strategies to implement treat all and achieve the 90-90-90 targets, to integrate programmatic achievements into the national health system, to achieve universal access to high quality services, to achieve financial stability by diversifying funding and eliminating inefficiencies, and then also to strengthen the legislative and policy framework to protect the right to health for key populations and other marginalized groups. And this broad approach has been captured in a sustainability planning matrix that HFG has developed and which has been reviewed by a range of international partners and country stakeholders in the Caribbean. So this is a matrix that has come out of the Caribbean work. And it describes priority outcomes in 6 areas, including, as you see at number 6, explicit attention to the protection of human rights. And we're very glad to be able to have this tool that brings together the technical support in the area of sustainability planning and which may be useful to other countries in the region as something they can adapt and use to begin their own planning processes or to create their own sustainability roadmaps. And with that, thank you for listening, and I'll hand things back over to Shanti.
Thank you so much, Sarah. Thank you very much, Lisa. That was indeed really very interesting. We have a few questions from our participants, and I'll encourage the other participants to type your questions in. So the first question is, great presentation. Can you expand on what is meant by less traditional funders? Thanks. Let me read one more question, Sarah and Lisa. The second question that I have here is, thank you very much for the presentation. I find the Barbados experience really very interesting, particularly the 39% household expenditure. How is this information factored into donors transitioning? How much weight is this given, especially considering the very low donor support to Barbados, the scale up of ART context? How is this considered in transitioning? So those are 2 questions for now. For other participants, please go ahead and type your questions in.
Thanks very much, Shanti. Actually, Sarah, would you mind taking the first question? This is Lisa, and I can talk about Barbados.
Sure. So I think, you know, certainly when in talking through the PANCAP resource mobilization strategy, we recognize that, as I said, we have not in the region done such a great job of tapping into the private sector. So even the private sector can be considered in many countries and at the regional level to be one of those less traditional funders. There are a number of private philanthropic organizations that work globally that have demonstrated an interest in issues, in working in the Caribbean, in working in issue areas such as LGBT rights, such as women's rights, and looking at gender issues more broadly. And I think we are also talking about, as I said, looking at taking a broader view of the drivers and the determinants of the HIV response. So looking outside of the health sector for funders that might be interested in supporting work in determinants like gender-based violence.
And this is Lisa. I'll address the second question on Barbados. It is an interesting example for sure. And while I cannot speak for the development partners themselves, I will say that if you look broadly at where development assistance goes, it tends to go to countries that are lower income. Barbados is an upper middle income economy. And while there is high out-of-pocket spending, it's not unique to Barbados. Other countries also, it's a problem in many countries in the world where while they want to offer services, free health services to all people, it's rarely a possibility really with government budgets and capacity. I think that where Barbados is, frankly, is it is a country with high capacity to manage their health sector. And I think because they have that high capacity, they are able to use these economic studies to make policy decisions that are astute and will strengthen the stability of the response. So there is low donor involvement in Barbados, and makes it actually more likely that the government will be able to take up the costs of And I think that knowing this 39% of household out-of-pocket expenditures is better than not knowing, let's put it that way. And now they have something that they can work with and begin to track.
Okay, great. Thank you, Lisa. There's another question from another participant who is saying that it's great that we're now conducting costing of CSOs response in the region. What is your experience in understanding the impact of CSO response? I believe that having this additional information or evidence will be significant in terms of advocacy to government.
Hi, this is Lisa. One thing that has been learned by development partners and the global health community is the involvement of CSOs, particularly in a health response where there is potential stigma or discrimination involved in the effectiveness of the response. The CSOs play a really important role, and I think that is very much appreciated by development partners, and as I was starting to say, that there have been lessons learned in other parts of the world, for instance, in Eastern Europe and in I think South Africa, where development partners have reduced or ended funding, and without a really strong civil society and the continued engagement of civil society organizations, there have been some gains lost. Let's put it that way, where gains were lost, and in some cases, situations worsened. And for instance, there is a study where it showed that they studied the transition of 3 countries away from global fund funding. 2 of the 3 became eligible again because of their prevalence rates after the transition. So those lessons have very much been taken into account. And the Caribbean, actually, if you go on the HFG Project's website, you'll find a paper about transition where we pulled together some lessons that have been learned in Eastern Europe from other USAID programs and applied them to the Caribbean context. And I can really see that the Caribbean is benefiting from some hard lessons that other countries have learned.
Hi, this is Sarah. If I could just add to that. So I think that demonstrating and maybe even quantifying, if we can talk about that, the impact of CSO service provision and the reach to key populations is a challenge and has been a challenge. But I think that the conversation at the national level and at the regional level is shifting, and one of the things that I could see going through this the CID process, in countries like Guyana and Trinidad and Tobago, is this very clear recognition from the national stakeholders, from the national government partners, of the value of CSOs in service provision and in reaching key populations, especially in those countries where they are formally engaged in implementation of global fund programs. And so there are mechanisms to support reporting of achievements by CSOs. And I think for those of you who were at the NAPS managers meeting in March of this year, there was a great presentation from Jamaica that showed how CSOs, and I think it was JASL in particular, could demonstrate impact with key population specific treatment cascades. So it is a challenge, but certainly the costing is a step in the right direction, and this is something that I think national stakeholders are much more open to have a much stronger understanding of.
Okay, great. Thank you, Sarah. I have another question from another participant. When applying social contracting, how do you address the disparities between government fee structures and the current CSO fee structures, which are significantly higher than local government fees? Government will not be able to pay for current donor-driven CSO fee structures.
This is Lisa. I'm guessing by fee structures, if I'm understanding properly, I think that they're talking about the budget and the cost as opposed to like a user fee.
Well, this question, sorry, Lisa, this question is coming from Suriname, if that will add some context to the question. Yep.
Well, it's a hard question and it's a really good question, actually. Well, I two comments. I don't think there's one clear answer to that question, frankly. I will say that some CSO programs are, when they're funded by development partners, they can include a certain level of overhead, which increases the cost in terms of reporting and management and possibly even an office overseas. And that can, once those trappings melt away, the cost can go down. I think the other thing that happens, what I've seen with CSOs in other parts of the world, is as the development partners begin to pull out and the reality of finding another funding stream really sets in, there's economies. They begin to cut back. They begin to see where they can become more efficient. They look and prioritize the services that are really the key services that they offer. And sometimes that means being more specialized. Sometimes it means partnering with other CSOs so that they can offer a broader range of services. Things are going to evolve, let's put it that way, and it may not happen next year, but over the next 3 to 5 years, the CSOs will adapt, and hopefully, and funding will come for sure, but it won't be the same scenario, obviously, as it exists now.
Yeah, I would just add just quickly that it's also, what's really important, I think, is to understand why those costs might be different, and to recognize that, that we're not necessarily talking about just inflated costs. It does cost more to reach some of the key populations and groups that CSOs are reaching with services that governments are not. And so we need to understand what is driving those costs in order to really be able to make sure that CSOs that are being funded by governments are really adding value in the response where they best add value. And also, as Lisa has said, to understand where inefficiencies can be identified and costs brought down.
Okay, great. So I have a question, Sarah and Lisa. And this is in relation to some of the information you presented on Guyana. Sarah, specifically the CID, and I've noticed that there's been some really big shifts between 2016 and 2017 based on the CID results in two areas that I've pulled out. And I've pulled these out specifically because I know that these were some of the strategies that Lisa outlined in her earlier slides. So I've noticed, for example, that there's been a really big shift in allocative efficiencies, and there's been a big shift in private sector engagement from 2016 to 2017. So my question is sort of twofold. Firstly, is this comparable? And that's simply out of curiosity. And my second question, the second part of the question is, what are some of the strategies that have been used to really make such a big shift in 1 year?
Okay, so it's a difficult question for me to answer, Shanti, because I was only involved in the 2017 CID process, and I can only sort of speak to that process, which I think was a little bit different from the earlier CID process in that it really tried to it engaged a very wide range of stakeholders, and also that by the 2017 CID, as you could see from the slide with that listed some of the studies that are available in Guyana, that there was additional research and work that had been done that helped to contribute to this scoring of the 2017 CID. So yes, there are shifts, and I think that this is one of the things that the CID really does allow well, is for countries and for stakeholders to see how programs are evolving from 1 year to the next. But I'm not really answering your question because I don't know why those shifts have happened. It's not something that I really have looked into.
Yeah, I know, but I think it's really interesting, and I think there could be some good lessons learned from the Guyana program for some of our other Caribbean countries. And I just want to, if I can build, this is the final question, to build on your comments, Sarah, to say that I noticed the list of assessments, studies, and so forth that could be used to sort of think through sustainability within countries. And I've just heard your comment on the CID. And so my question would be, if another country is thinking about a similar process that Guyana has gone through, what would be maybe your top 5 pieces of information that you think would be really important for countries to have, sort of your must-have?
You're asking all the hard questions. So I think that's what we tried to do with the sustainability matrix, and hopefully that's something that we can share if people are interested in it. So I mean, the process is quite a simple one. I mean, what we did was start just by compiling the documents, just by looking at what is there, and I guess the idea, Shanti, is that you look across those areas of the matrix, so political, sustainability, financial, epidemiological, structural, programmatic, human rights, and really it would be about having some kind of baseline evidence in each of those areas.
Yeah. Okay, great. Thank you so much. I think we've exhausted all of our questions this afternoon. And so this brings us to the end of our webinar. On behalf of the Director of PANCAP, Mr. Derek Spring, and all of our participants today. Let me thank you, Lisa and Sarah. I think this has been an excellent presentation. It makes me feel like we should continue this conversation and maybe take from your last slide, Sarah, each one of the different forms of sustainability within that framework, and maybe have a series of webinar, if I can call it that. But thanks again for investing in this webinar, and by extension, the PANCAP partnership. I want to thank all of the participants for joining us and for an excellent discussion this afternoon. You will receive a very short questionnaire once we've closed the webinar. Thank you so much for providing your feedback to us. Please do join us for our next webinar on July 25th as we discuss hepatitis B, focusing on the public health approach to the elimination of mother-to-child transmission plus EMTCT plus. Also, please do stay engaged with the regional response. Follow us on our social media platforms, Facebook and Twitter. And thanks again, everyone, and have a great day.
Thank you.
Thank you.